A very good afternoon and welcome on this to the session today on the topic premature birth. The doctor for today is Dr. Alok Kumar Gupta. We welcome you, sir. And for Apollo Cradle and Children's Hospital, Greater Noida, today's topic is very important for all the mothers, especially the first-time mothers, the new mothers, and everyone's facing these issues right now. So I think you should take care of all the questions, and the doctor is here to answer. Just post that on the comments chat box so that we can take it by the last of the session. Also stay tuned because we'll be taking all the queries related to the topic, or if you want to ask anything to our doctor by the last. Doctor, you have the stage.
Good afternoon, everyone. My name is Dr. Alok Gupta. I'm a consultant neonatologist and pediatrician at Apollo Cradle, Noida. Today, we will talk about the premature birth. We will know what is premature birth, why it happens, what is the long-term complication, and how can we manage an NICU, and what things to take care of preterm babies at home. So first, what is premature birth? Premature birth is birth when baby is delivered uh, when gestation is less than 37 week. That is known as preterm or premature birth. What are the reasons for preterm birth? Are also known as premature birth. There are many reasons. There are some common conditions are typically in multiple gestation when they are twins or triplets. When there is infection in the uterus, then mother has uncontrolled diabetes mellitus as well as uncontrolled blood pressure. They can have preterm birth. If there is bleeding in uterus, as well as if there is premature rupture of membrane, this all can cause preterm birth. So next question is what kind of problems arises if baby have preterm birth? So basically, first we should know when baby is in the womb, their different organ system of the body is continuously developing. In case of premature birth, baby does not have enough time, so that all the organs are immature. That is causing problems after birth. The more earlier the baby is delivering, the lesser the weight and the more likely to have complications and health problems after birth, like a baby which is 28 week of gestation, and if we compare it with the baby which is 34 week of gestation, 28 week gestation baby will have more problem and complication after birth as compared to 34 week baby. So what are the common issues this baby face? The first common issue is trouble in keeping warm. This baby cannot maintain temperature because of their prematurity. So in our NICU, we have automatic heaters as well as the incubators which maintain the temperature of these babies. Second is breathing problems because their lungs are not does not have adequate time to fully mature. That's why they are not working properly after birth. This condition is known as RDS, respiratory distress syndrome. For this baby may require ventilators like CPAP, HFNC, and this baby requires certain special chemicals known as surfactant and caffeine, which really help in breathing of this baby. Third is heart problems. The congenital heart anomalies are more common in mid-preterm babies as compared to the term babies. Most common of them is PDA, that is patent ductal arteriosus. This type of tube which is closed in the term baby, in mature babies. But in case of premature babies, this is kept open, which causes many problems with the baby. Fourth is the digestion of the baby. Like other problems, other organ system, intestinal system and gastrointestinal system of the baby is not fully matured. So this baby have difficulty in digesting the milk. So this baby frequently have vomiting, diarrhea, blood in the stool, abdominal distension, also known as stomach swelling. This condition is known as necrotizing enterocolitis. That is very serious issue which can cause very long-term impact on the premature baby. Infection. These babies have increased chances of infection because they have less immunity. Although we took extreme care of asepsis in the NICU, like hand washing, minute touching of the baby, but still these babies may get infected at any time during NICU course. Third is bleeding in the brain. This baby has very fragile brain because their covering is very fragile. By slight shaking itself can cause intraventricular hemorrhage, also known as the intra-brain bleeding, which can cause serious short-term and long-term complications in these babies. And jaundice. Although many babies newborn get jaundice, but premature babies have more incidence of jaundice as compared to mature babies. And now the next question arises is how we manage this preterm baby in our NICU. As I told earlier, we keep the baby in incubators, automatic heaters, so that they can keep their temperature. And this baby require ventilators, CPAP, HFNC quite frequently. These babies need oxygen, feeding tube, surfactant, phototherapy, and in some cases, some these babies require surgery as well. Now, next question arises in parents' mind: will my baby have any long-term complications? Yes, you maybe may have long-term complication, particularly when the baby is extremely mature. Like earlier the baby is born, there's high chances of long-term complication. Most important is cerebral palsy. There is a problem with the balance as well as the movement. These babies, babies which are extremely premature and having brain problem at the time of birth, like bleeding, infection, they are more prone to get to develop this complication. Second is vision problems. Particularly in the premature babies who are less than 30-week gestation, these babies may have some vision problem like farsightedness and nearsightedness in the future. Although we keep checking the eye and we keep doing the eye screening during the NICU course so that they have less chances of this vision problem in later life. Third is the brain problems like ADHD, also known as attention deficit hyperactive disorder, learning disorder. They are more common in the mature babies, but if we can detect early, they can be resolved in later life. Then growth problems. The mature babies have less height and weight as compared to other mature babies in later life as well. Then there are some ongoing health issues like these babies get sick more often, like they want to develop diarrhea, fever, cough, cold more commonly as compared to mature babies. So next question arises in the parent's mind is what special care the preterm baby needs as compared to term baby. Feeding. First is feeding. You have to give katori and spoon feeding to the premature baby along with breastfeeding because katori spoon feeding is much easier to accept as compared to breastfeeding. And we at the time of discharge we usually teach mother as and one more female attendant how to adequate technique, that is how to give katori spoon feeding properly to newborn baby. If they are confident enough in feeding the baby, then only we discharge the premature baby. Second is kangaroo mother care, also known as KMC. KMC is very low cost and very important method which really helps in the growth of the baby, in gaining weight and stimulating his brain as well as a future outcome. It is also called as KMC is also known as baby's right and mother's delight because it can be done up to 2 kg of weight and father can also do it. KMC actually stimulate all the five senses of the baby like vision, hearing, smell, taste, and touch. And it really helps in the stimulating the brain of the baby and optimizing the future outcome. Third question is when can you can give birth to the baby at home. Usually in case of premature baby, bathing is not required in first month. Only tepid water sponging is good enough. After first month, when baby is more than 2 kg, you can give bathing once or twice a month. Fourth is massage. You can do daily massaging before sponging. Massaging duration should be at least 10 to 15 minutes per day. You can use coconut oil, baby mineral oil. It really helps the weight as well as the skin to skin touch. Actually, increase promotes the mother and the infant bonding. Then developmental supportive care. In this, there are many ways you can engage with the baby, which really stimulates the brain of the baby. Like you can apply some mild music should be going on around the baby. Then you can talk to the baby, you can touch the baby, and you can give KMC twice a day. This really help in the development of the baby, also known as development supportive care. Then one is family centered care. Parents and family are integral part of the NICU team. Here, not only the mother, the father, as well as the other family attendant can really take care of the baby. Then next question arises. Uh, Vaccination. We usually give vaccination at the age when the baby gains weight of 1.5 kg weight. After that, we usually all the routine vaccination like 6 week, 10 week, 14 week, like the mature baby, we usually give vaccination to the premature baby itself. Is there any question? Is there any question? If there is no question, I conclude the session. Thank you.